Pima Heart and Vascular has been in Southern Arizona for close to 40 years now, and we provide all sorts of service starting from preventive services all the way to complex cardiac procedures including open heart surgery, valve procedures, transcatheter procedures, complex interventions, things like that. Cardiovascular disease is the #1 killer in the US, and we have plenty of locations where people can reach us within 30 minutes from their home, and we are affiliated with most of the hospitals in town. So critical care, we are there. If it's preventive care, we are there within 30 minutes.
Patients often ask what a vascular surgeon does, and usually what I say is we treat all the blood vessels in the body, arteries and veins that are not in the brain or in the heart. That means we treat carotid artery disease to prevent stroke, we treat aneurysms, we treat peripheral arterial disease to save limbs, and we treat patients who need dialysis access, and we treat patients with DVTs, pulmonary embolisms, and varicose veins. Peripheral arterial disease, or PAD, is a very common ailment, affects many older Americans with either a history of smoking, high blood pressure, diabetes, or a family history of peripheral arterial disease. Some things that patients with peripheral arterial disease might experience is pain with walking, pain at rest, or non-healing sores or ulcers, which can become a limb-threatening disease. Peripheral arterial disease is easily screened with an ultrasound and a physical exam. If you see one of our physicians, we'll start by taking a full history and physical, and if needed, we'll be able to perform an ultrasound to see if you have or are at risk for peripheral arterial disease. In addition to providing great clinical care, Pima Heart and Vascular is at the forefront of innovation. We are involved in over 60 clinical trials just this year alone. We partner with universities and industry partners in order to provide cutting-edge research and clinical care to our community.
Consequences can be pretty bad if hypertension goes unchecked. It can affect almost every single organ in the body, starting from the brain. It can cause a stroke, it can cause heart attacks, heart failures. It can also lead to what we call aortic dissection and aortic aneurysm, which is things that happen to the larger arteries in the body. It can also result in people ending up on dialysis. We have plenty of locations in and around Tucson, including the suburbs, and we have all the way down south to Nogales. We have Sierra Vista, Safford, Douglas. We have clinics there. Our main thing is we want to be able to, for people to get to us. Accessibility, we want that. And also we have staff who speak Spanish, so it's easy for people to come to us and have a conversation. We get a phone call in the middle of the night. We care about our patients, so I don't mind taking the phone call, being there in person in the hospital to take care of things.